Well, now to a startling statistic. According to the Mayo Clinic, nearly 3 out of 4 women will have uterine fibroids. Now, fibroids are cell growths in the uterus that can shrink, they can grow very large, or just stay the same size over time. Now, they can vary from one woman to the next, and sometimes they can be extremely painful. So when it comes to fibroids, what's normal? Well, Dr. Keri Peterson is an internist and contributor for Women's Health magazine, and she's here with some of the answers. Dr. Keri, good to see you.
Great to see you, Dr. Steve.
So let's talk about who's at risk for fibroids, because I don't think a lot of women realize they may be at risk.
That's right. Well, we don't know exactly what causes them, but risk factors will include a genetic predisposition. So if your mom, your aunt, your grandma has them, there's a good likelihood that you'll have them as well. In addition, if you're African American, you're 2 to 3 times more likely to develop fibroids. Also, if you're obese, that's another risk factor. Now, this we understand why. Fibroids are sensitive to stimulation by estrogen, and overweight women have higher circulating levels of estrogen, therefore they're more likely to grow them. And then finally, if you've never had kids, that also increases your likelihood, because something about pregnancy protects you from developing them.
Okay, so we have our risk factors. Let's talk about some of the signs and symptoms, because some women don't even realize that the pain they're having is actually a fibroid.
That's right. Mind you, the majority of women have no symptoms at all. They're typically found just on routine pelvic exam. But if they're a little larger, depending on their location, you can feel them. So for example, one of the most common symptoms is heavy menstrual periods or bleeding between periods, because the fibroids themselves can ooze blood. In addition, if they're pressing on the bladder, you can get difficulty with urination and difficulty emptying the bladder. If they're pressing on the colon in the back of the uterus, then they can cause constipation. And if they grow very large, which they can even grow up to the size of a grapefruit, then they can just cause lower abdominal pain.
Right, so eventually they can have no symptoms at all or have serious symptoms. And
yes,
here we got examples of where the fibroids could be found in different parts of the uterus, because they're actually like these muscular tumors, if you will, right on the uterus itself. So let's talk about treatments, because a lot of women, I think, will be surprised to find out there are some pretty good treatments out there for fibroids.
Yes. First, there's the non-invasive treatments, and these are designed just to relieve symptoms, and most women do not have symptoms and don't need these, but if you do, the most common thing that's used are non-steroidal anti-inflammatories like ibuprofen, just to treat the pain. You can also use birth control pills. These control the pain, and they can help shrink the fibroid as well, and help control your periods, making your periods a little less heavy. Also, iron supplements are used. If you're anemic because you're bleeding heavily, these can help replenish your iron stores. And then finally, there are hormonal injections. These are also less invasive. These can be used to shrink the fibroids as well. So these are non-invasive procedures. Now, there's also invasive procedures that involve usually some sort of surgery. The most interesting one is uterine artery embolization. This is a long word, but what this means is that you are essentially decreasing the blood supply or eliminating the blood supply to the fibroid so that it dies. And because it has no blood supply, it shrinks, it shrivels up, and it dies. Now, if that's not an option for you, then there's surgery, and there's many different techniques. The standard is called a myomectomy. That's just a fancy term for cutting through the abdomen and taking the fibroid out. But this can also be done through the vagina into the uterus with an instrument called a hysteroscope. So that's a less invasive way of removing the fibroid, and that would be done if it's in the inside of the uterus, in the wall of the uterus itself. And then lastly, if you know that you don't want more children, you can have a hysterectomy. Takes the entire uterus out, you solve the problem.
So the bottom line, Dr. Keri, is that women shouldn't have to suffer from this at all, especially if you're in a lot of pain. So lastly, I just want to talk about how having fibroids affects fertility.
Yes. Very important issue for women and a concern for them. Just to reassure women, the majority of you who have fibroids, it will not impact your fertility at all. The only issue that can come into play is if the fibroid is in an unusual location. If it's obstructing the fallopian tube, then it can interfere with the sperm going into the tube and fertilizing the egg. And in addition, if it's a large fibroid that's within the uterine cavity, it could potentially interfere with the embryo implanting on the uterine wall. These are rare, though.
All right, Dr. Keri Peterson, thanks so much. Really appreciate it.